You're listening to Probability Matters, brought to you by the Rocky Mountain section of the AIHA. Welcome, everybody, to the third episode of Probability Matters 3.0.
3.0.
I am your host, Kyle.
My name is Wangi.
And we have a special guest with us today.
Very special guest.
Very.
Hey, everyone.
Do you know who that is, everybody?
I don't know. Could you introduce yourself?
Sure. Hi, I'm Roberta Smith, and I'm a part of the Rocky Mountain AIHA and have known Wangi and Kyle through our activities through AIHA and part of the IH community here in Denver.
Absolutely. And Roberta, today, I think with everything going on right now with public health and industrial hygiene, you have a very unique background. You are both a nurse and a certified industrial hygienist. That is a very interesting intersection of those. So I think to start things off, how? Like, why? How did you get to that?
You know, I ask myself every day, like, what do I want to be when I grow up? And, you know, that question is always coming up. But yeah, I've had a very interesting journey to get here, and I actually started out at CSU.
Oh, you did?
Yes. So my degree is in environmental health. I went to CSU, and when I graduated, you know, the environmental health degree is very broad,
right?
And there's so many facets that you can take with that. And I didn't know what I wanted to do, so I went to the Peace Corps for 2 years to try to figure that out, and had done a couple health activities when I was within Peace Corps. Mm-hmm. And when I got back, it was the big question, where do I get a job?
Right.
And my first job was actually at the state of Wyoming at their health department, running their immunization program. So I really took the public health path and found myself then in Denver at the Colorado Department of Public Health and Environment in their immunization program. And I actually ran the influenza program for about 7 years and adult immunizations. But what I found myself asking was, you know, hey, I'm giving all these people advice on how they should get their flu shot. I'm talking to infection control nurses, and I really wanted to have more of a medical background to be able to help and understand and give out this public health advice. So I went to nursing school and got my nursing degree, and kind of throughout that process, I knew I wasn't maybe going to be your typical nurse because I had also gotten my degree in public health, so I'd gotten a master's in public health, and said, you know, I like the epidemiology, I like the education, and I really sought, after I got my nursing degree, to get a job in infection prevention. Okay. And so I did that. I was an infection prevention nurse for about 7 years. But in that role, when I was working in that role, they knew I had this environmental health background.
Right.
So whenever construction projects came up, I was the one helping with the air sampling, looking at the air pressures in the isolation rooms. I was doing the water sampling, and they had kind of put me in charge in that industrial hygiene type capacity. Right. And so I was doing all of those things, and I said, well, this is, you know, maybe I should look at getting my certification in industrial hygiene, because there is such a crossover between this infection prevention and what an industrial hygienist does.
Right.
You know, when I looked at that matrix, I'm like, oh, these line up really well. So I got my certification in industrial hygiene, and then really found myself kind of shifting directions a little bit to focus on occupational health. And that's where I ran and helped to manage an occupational health clinic within the hospital that I was working at, Children's Hospital here in Denver.
So what do you think, from your perspective, are the most important intersections of, from a public health point of view, and industrial hygiene.
Right. You know, it's amazing. Whenever I do a lecture, I always throw up the hierarchy of controls. And that is such a universal concept that crosses both public health and industrial hygiene and what we use in safety. And it's just really the language that you use to explain that. And, you know, when we talk about, let's say, COVID-19 right now.
Sure.
The best thing you can do is eliminate it, right?
Right.
So social distancing, that's a huge public health concept. It's something that we as industrial hygienists also understand. And it's like, how do you then take all of these concepts and put it in that language for that audience? So there's really a lot of crossover in those two areas that I think maybe not everyone realizes every day.
Absolutely.
Have you met other nurses, or let's say nurse becomes IH becomes nurse, kind of?
I've met one.
Really?
Yeah, and it's funny how some people in LinkedIn will send me a message, oh, you're a nurse industrial hygienist too. And, you know.
Do you guys have a convention every year or something?
2 people, Kyle.
Yes.
Maybe Starbucks.
Yeah.
Right, exactly. Well, you know, and I've been asked the question in job interviews, well, how do you identify? Do you identify as an industrial hygienist? Do you identify as an occupational health nurse? And, you know, again, it goes back to my audience. And I feel like, you know, there's a lot of us industrial hygienists that are in healthcare, and we really get it and kind of understand the connections that those two professions can have. And so it really depends on who I'm talking to, and I will modify how I explain things or how I educate based on that audience.
So I'm just coming from the outside looking in, but I'm thinking, you know, what's the case for an industrial hygienist within healthcare? Because I think of industrial hygienists as typically within industry, and I'm talking general industry, manufacturing, etc. Why is there a need in public health or in healthcare, period?
Right. Well, if you look at healthcare, if you look at a typical hospital situation, it is kind of like a small village.
Yeah.
You know, you've got rooms where you need ventilation monitored. You need to understand pressurizations, so you're keeping sterile areas sterile. So you need someone that understands those ventilation concepts, which I think is a huge piece of IH. I mean, when you're studying for the exam, you're like, oh my gosh, you know, trying to understand those ventilation pieces. And also, you've got chemicals that are being used. Right now in healthcare, the big thing is USP 800, and this is how we handle hazardous drugs. So you're getting pharmacists involved, you're getting occupational health professionals involved, you're getting industrial hygienists involved, because they need to know how drugs are being handled properly, if there's any exposures, how you're sampling for those. And it's really a team that works together, and knowledge from each of those areas really come together in those situations to really have a comprehensive practice.
And that's so everybody's probably familiar with the standard MSDS. This is sort of an approach like that, but far more comprehensive with everybody. That makes sense.
Absolutely, absolutely. And it's unfortunate, it's like coming to light now, but we've had hazardous drugs, we've had anti-neoplastics to treat cancer for years. And it's just, I feel like now that's becoming important. And when we talk about data, that's a huge challenge, because we haven't really been looking at that population of people that have handled hazardous drugs and really tracked them to see any outcomes.
Can you elaborate on that a little bit more?
Yeah, absolutely. So when you're using drugs, when you're handling drugs for patients that have cancer, these drugs are toxic because they're meant to kill cells.
Right.
So if you're not handling those properly, if you don't have the correct PPE, if you've had a spill or something like that, a nurse or a pharmacist could have been exposed to that. And I don't think we've done a good job tracking those events and then following that employee throughout their history to see what that outcome is. You know, is it cancer? Are we seeing more rates of cancer in healthcare professionals? Well, you know, we really haven't done the studies to determine that. And I think that's a great question that we should be studying.
Sure.
NIOSH totally has recognized that need and that lack of data that we have in that area because it's just, you know, wasn't something that occurred to people. And, you know, it's really a struggle right now in occupational health. We can survey people. We can ask people, what's your exposure to drugs? Are you wearing the correct PPE? Have we done the correct engineering in these rooms where we're making these drugs? But it's kind of stops there. And that's where I think we're struggling right now is how can we then, okay, if a spill happens, what tests are we going to do? What type of medical surveillance are we going to do for those employees and track them over time to see if there's an outcome? And I think, you know, having that background in epidemiology, having, you know, the skills to be able to describe situations and outcomes, I think is all going to be coming together here in this new process of hazardous drug surveillance, medical surveillance,
and through big data and through surveying that.
Absolutely,
that's very, very interesting.
Yeah, I was going to say, I think Roberta is the embodiment of what we've been talking about, Kyle. Somebody who is not just saying I am this, but saying I recognize me gaining skills in this other thing is going to make me a better profession. Kind of like we say with the data part. But it's also interesting as you gain those skills, you brought up something. It's almost like we seem to be better. Correct me if I'm wrong. We can respond to the public part maybe of these infectious diseases better than we can even deal with our own people, because perhaps if it's their spill, like you said, of that drug or that chemical, the tendency is the potency is higher. It's a scenario which we didn't envision. And sometimes those decisions are made in haste, right? So it's strange that even the professionals themselves who were charged with these public health either initiatives or managing these responses are sometimes the most vulnerable themselves, right?
Oh, absolutely. Absolutely.
Yeah.
And, you know, through all of those skills, so like with nursing, you develop an empathy, you know, and you know how to maybe talk to someone. As an industrial hygienist, you know, you can kind of give that technical know-how and talk to that situation that way. But yeah, in every public health scenario, you're going to have to manage risk, you're going to have to communicate risk, and it's how you do that to your different populations.
And I think we're seeing all that play out with coronavirus, COVID-19 right now. Mwangi and I were texting before, but just last night, a friend of ours has a brother that is a nurse in an affected city, and that brother was notified that he had been exposed. Don't know if there was anything, but that's a front line. I mean, people really need to understand the front line and then what happens and then how we can contextualize it. So what you're mentioning, I think we're seeing play out on a global scale right now.
Yeah.
And I'm interested in your perspective in terms of, there's a lot of coverage on this, in terms of how you view this through the lens of an industrial hygienist and a nurse and an awesome person. How does all of that, what is it from your perspective that you would like maybe people to be talking about more, or maybe some misconceptions or things that you feel are important about this?
Right. Yeah, and there are a lot of messages, and the messages do change every day, but I think the bottom line is good respiratory hygiene. You know, I always say, you know, what your mother told you, wash your hands, and cover your cough. Those are all great practices that we should be doing all the time in public health. And what message I would like to get out there is keep calm We all need to have emergency preparedness plans. I think as industries, we create emergency preparedness plans for natural disasters, hurricanes, snow days, those types of things. Let's go back to those and dust those off and see, if they're still adequate, even in your own home setting. The CDC years ago, when The Walking Dead came out, they had a great zombie apocalypse planning guide.
Sure.
That's great.
Right.
Pull that out. Plan for the zombie apocalypse. Get those things. I even went through our cupboards last night, and I told my husband, I said, I think we might need to just get a couple supplies here, and that's smart. That's smart for anything. But don't panic. Don't throw it into overload. I think one thing we need to recognize is the use of masks. So a lot has been going around about N95 respirators. And as industrial hygienists and safety professionals, we know that an N95 is not going to be effective unless you're adequately fit tested for it.
Yes.
And that's the message that I don't think is getting out there. They're just saying, well, N95s only work for healthcare professionals. Well, what's special about a healthcare professional that an N95 respirator is going to work for versus, this guy on the street? Well, it's because they have been properly fit tested for that.
For people who may not know what a fit test is, can you unpack that really quick? Because I agree, you're not hearing that mentioned at all.
Right.
And everywhere I go in industry, I mean, I used to sport a beard or whatever. I mean, I was told to shave before I entered a property. So can you define what a fit test is and why it's that important?
Yeah, so fit testing is a way that you can test the respirator. So N95 respirators tend to have a seal, or they do have a seal, that encloses your face so that nothing can enter or escape. So it's really tight fitting. So what a fit test does is it determines how well that is fitting to your face. There's a variety of respirators, and we all have different face shapes. And so one respirator may not work for the other person.
Right.
So you can do either a qualitative or a quantitative fit test. So you can use a substance like Bitrix is the name. It's a very bitter substance that is sprayed in your face, essentially, and while you're wearing the respirator. And if you can taste it, you know that you have a breach in that respirator. A quantitative fit test actually will measure the particles that are kind of in the environment where you are in, and the particles within the respirator itself, and it measures the ratio between the outside and the inside particles, again, to see if you have an adequate seal to that respirator.
Right, and I think we talked about this in our last episode about devices, and just because people think that something is there and it's labeled safety, well, I just do the simplest thing. That's a relatively complex way. And so what we possibly have now is globally people are buying N95s, they're flying off the shelf, but they're probably not properly prepared to wear the item and how to do that properly.
Absolutely.
And I was going to say too, Roberta, part of that is also training. So not only do you get to fit it, I don't know if some of these people that are buying these respirators are actually trained on how to. I know it's you put on a respirator, but there's ways to test whether it's a good seal, et cetera, because there's a devil in that device too, Kyle. I think that's what you're trying to say.
Absolutely.
You don't just pick it up and put it on. I mean, it looks easy, but what Roberta just explained, you can see is it's not that simple.
It doesn't seem like that easy to do at home. And by the way, spraying my face with bitter stuff at home, I mean, I want to be preventive, but that doesn't seem like a very pleasant experience. So it's very difficult. So on the term of what's not being talked about, I think fit testing around N95s, people are saying, get the N95, don't do the other mask.
Right.
That's one element I think is really interesting. From your point of view, what are some other perspectives when you look at this coronavirus COVID-19 coverage that you think need to be brought to light?
Well, I also beyond, so the N95, again, we can talk about labeling of that because that's a certification that comes through NIOSH. I think another thing that's not being talked about are kind of the buyer beware. You know, we are in a situation where people are maybe panicking and scrambling for the next best thing. And this is a situation, unfortunately, where people might take advantage of the lay person who may not understand. And when we talk about cleaning and disinfection, you know, a general household product will be, if it is an EPA certified product, it will tell you what viruses that it has been proven to kill. So a household product such as Lysol, Clorox, wipes that you would find in the grocery, you can look on the label and it will say human coronaviruses on there. Maybe it will say influenza H1N1, and you know that, okay, I'm good to go. This product is going to be helpful for cleaning my surfaces. There's a lot of new technologies that are out there for cleaning and disinfection that have been used in healthcare settings. And you know, if those are being sold or those are being marketed to the general public, it's really not appropriate. So a couple cases in point, we can see ozone generators. You can find them on Amazon as a clean, purifying air freshener and UV light. And these have inherent hazards to them. And if you are a lay person and you're going on Amazon to find the next best product that's going to help you, you know, you can be duped, and that is what scares me as well. And I don't think that's being talked about enough either.
Maybe cause more harm than good.
Absolutely.
Right?
Yeah, and you've got people out there now just getting into this health and safety thing. It's not easy.
Right.
And the technology that's here is not necessarily right out of the box ready to roll.
Right.
There's a lot of complex things. So yeah, you could have stockpiles of resources and homes and businesses, people doing what you would advise to do, which is come up with a plan, but have an inherent misunderstanding and a misguidance about what they're wanting to do. I think that's a fantastic point to bring up.
Yeah, and in safety, you know, we know you shouldn't mix bleach and ammonia, you know, those types of things. You know, wear those messages on being safe with chemicals in cleaning. So, you know, I've advised my friends, I'm like, you know, just go out, get the regular household stuff, you know, don't get the green stuff because that's not tested by EPA. Look for that EPA label on there, and you can actually go to the EPA website and look up a product and see if it's been tested for certain viruses. And that is really, you know, going to some of these really validated websites, I think, is also something that people should be aware of. EPA, CDC, WHO, you know, they're going to be giving accurate information, and that's where you should be seeking your information.
Absolutely, and I think the broader context of all this, which is, I think, Mwangi, you brought up this point, is what does all this mean? Because you're in infectious diseases. We deal with infectious diseases all the time. So currently, for the average American right now, coronavirus, at least COVID-19, isn't an issue. But I'm a complete layperson, and you had mentioned coronavirus already being tested. Coronavirus is a thing. There are derivatives of coronavirus that always happen, that are always around us, right?
Absolutely. Yeah, we see there are some strains of human coronaviruses that we've seen. Most recently, we've seen SARS and MERS, which I think also have gotten some publicity as of late.
Sure.
So we're revisiting some of those situations. But if you were, you know, even... We were talking about this in one of our AIHA healthcare conference calls. When someone is tested for a respiratory virus, there's a whole viral panel that they'll do. They'll run influenza, they'll look for rhinoviruses, and they'll look for coronaviruses. So we had one IH who said at their hospital they were dealing with patients that saw their results and it said coronavirus.
Right.
And they're like, what? You
Freaking
know?
out.
And no, there are human coronaviruses that we have seen, and that is what circulates in every respiratory season that does cause the common cold. So the virus itself is not new.
Right.
I think the first time we actually saw coronaviruses or they were identified in humans was back in 1949.
Okay.
So, 70 years we've kind of known about them, but we do see them circulating in animal populations as well as humans.
And that's a general context. I don't think people are out there understanding that there are multiple derivatives of this.
Right.
Yeah.
And that's what's going to make this whole situation a little bit harder.
Right.
Because we're already in respiratory season. How many people have had a cold already this
Yes.
season? Yeah, exactly. And so when we look at the burden on the healthcare system, we've got people that are going into and accessing healthcare
Right.
because they have a respiratory virus. So it could be influenza, it could be, a severe rhinovirus, it could be para-influenza. We've got a lot of respiratory strains that do circulate. And unfortunately, when we see a population that might be more susceptible to these viruses, they'll seek healthcare. And so we've got a burden already in healthcare due to the respiratory season. And now we're going to compound it perhaps with people that are the worried well, going in, maybe seeking healthcare when they maybe don't need services.
Right.
And then we might have people too that are affected by this new coronavirus kind of entering healthcare as well. That is why we're seeing a shortage of PPE. Because we're already using PPE for protection against respiratory viruses. And now with the public increasing their awareness and going out and buying surgical masks, buying, the N95 respirator, it's creating a shortage that is actually hurting our healthcare workers and having them scramble for alternative solutions.
Right, so that frontline PPE is being taken away from the people who need it most.
Right. And again, going back to being an industrial hygienist and a safety professional, we want to keep workers safe.
Right.
They should not be compromised because of the job that they do and the profession that they've chosen. And we need the best that we can do to protect them.
And in some way, it seems like the respirators become so. That's what you find in most articles. So it's now PPE is the first resort rather than the last resort, like you said, Roberta, right? Because
to the
it just seems like
controls.
to the hierarchy of controls. Because right now it's like, okay, get the N95. We're running out of N95 and the people that really need them don't get them. So people assume, well, okay, now I got my respirator, I should be good, ignoring all the other things, right? Like let's talk about maybe. Where you're going to go to try? It doesn't mean you have N95. Now you should land in Italy and be good, right?
Right, exactly.
Also, that information, some of that back information should say, like, that helps you. This is, like Roberta explained, it's about what's outside that respirator and what's inside. But do you shower with that respirator? Do you,
do you eat with
what
that?
after that?
Yeah. And you always look on the hierarchy, and Mwangi and I are big fans. Like, we should just have a poster of that.
I think a tattoo. Tattoos. Let's go get
Mwangi,
tattooed
let's
right
do
now.
it. I swear, I'm
So
totally.
you do one half and I do the other half, and we put our arms together or something.
Yes, when we're linked combined, that's fantastic. But these are all great ideas. So, but the one thing on the hierarchy of controls is it's the least effective way to solve a safety problem. And PPE is our first resort. Very important. Not downplaying PPE at all. It's very important. But at the end of the day, it's still the least effective way to go about it. And do you find in the terms of the hierarchy of controls, when we're dealing with infectious season, which is this season right now, what are some things that, from your perspective, from an industrial hygienist perspective, that businesses, safety managers, other industrial hygienists that aren't in healthcare can do to manage influenza through the hierarchy of controls in maybe a more effective way?
Right. And I think the biggest thing, like I said, is elimination.
Right.
If you're sick, do not go to work. Don't be that hero that goes into work and says, oh, I feel awful, but I'm here today and I'm getting my job done, because then you're probably infecting all of your coworkers. So looking from a business standpoint, it's probably a lot easier for a company that's not in manufacturing, like if it's a software tech company, customer service, where you could potentially do a job from home. I think that is easy solution.
Sure.
get those work from home policies, make sure that you've got a VPN or something that supports that for your employees, encourage them not to come into work. But when you look at a manufacturing or a service job, again, that's a different scenario. So what businesses need to be looking at is, let's look at our business continuity plans and how can we perhaps manage on a short staff? How could we maybe change hours where if we know we're going to have less production, how can we maximize what we're doing given a short supply of people? So I think that's one thing that businesses really, but that's in any situation, right?
Sure.
It's not just a pandemic. That would be for a natural disaster. And as safety professionals in industrial hygienes, we write those plans.
Right.
And I think sometimes we write those and we put them away and we don't exercise them. We don't talk about them.
Or add to them, because it could even be like servers go down.
Sure.
Right.
You don't have access to that. That can be a crisis depending on what kind of business you have. Natural disasters. So, in essence, you can do this maybe one document or this one program to cover a bunch of stuff, because some of this stuff is some of the reaction or what you're going to do, maybe prepare or drill on. It's pretty similar. It can be pretty similar, How do you engage with the public, or is it just local? That kind of stuff. Who do you have for, resources? Do you know if you even have an occupational health department in where you live, and that kind of stuff? So
yeah,
I would advocate for anybody who's listening to think about some of those things. So whether it's whether it's viruses, whether it's, again, natural disasters, whatever you think of that can make you vulnerable as an individual and as a business, I think consider it.
Well, we always talk about these moments, and what's interesting about the industrial hygiene and safety professional, I don't know if it gets enough credibility, is it's almost like they're camouflaged in the general world, and people don't recognize that everybody's sitting here with doomsday clocks on their wristwatches looking and going, okay, this is what we're planning for, this is what we're planning for. Now it comes to find out, I should have, got it. They were looking for the long term. Got it.
Right.
And that moment, that doesn't happen all the time.
Right.
This moment has happened, and I think there's a lot of lessons that can be learned from the industrial hygiene safety community in terms of principles, philosophies, and how that's applied. And some of those really come to light when things are the worst. And like Mwangi mentioned, that plan.
Yeah.
Where is that? What does that even have to do? Is that on the paper that has the holes on it?
It has like
from the site?
it's in the old version of Word, and you got to convert it. And
It's actually in a binder. Yeah.
Well, and someone wrote it and they've now left the company,
Yeah,
and what were they thinking by this term,
Absolutely.
So that is just a really, really good practice. And, going back to kind of the hierarchy of controls, staying home from your work when you're sick, that would be elimination.
Right.
And you can step up your cleaning that you're doing in your office. We talked about, some of the household cleansers that will work. One company I was talking to, they said, well, we're just going to hire out someone to come clean. We don't need a cleaning plan because we're not going to be doing that. We're not going to have our employees doing that. Well, guess what? The cleaning company is probably going to be affected too.
Right.
So they probably won't have enough staff to come and clean.
Right.
So educate your people on how to use a wipe and how to protect themselves using chemicals and a wipe, and, make that part
and
of
what
your
is
plan.
a cleaning company exactly, depending on how they certified? Because they may bring it to you, right?
Yeah.
They may
Right.
bring it from somewhere else and bring it to your office. You don't know.
Right. And then,
how they clean things.
Yeah, absolutely. Yeah.
right. And then, they said, well, we're going to hire someone that, is experts in this. I'm like, okay, are you dealing like with a dead body? It's just regular cleaning. And, there's really nothing special about it. And then again, that could go back to that buyer beware.
Sure.
You might have cleaning companies that say, oh, we're specialized in killing COVID-19. Okay, well, that's just really using, a quat or, a bleach or something, so.
Yeah, everything can be spun in that manner.
Yeah.
Yeah.
So.
So, Roberta, on Probability Matters, we love talking technology.
Love it.
So I was going to ask you, for you, whether it's on this, the coronavirus, or your experience as a nurse or IH, what are your thoughts on you, me, and Kyle have had conversations again, just, before about this topic. We presented at FTC together. Where do you think, so what's your future for the nurse in you, maybe the IH in you, and even with this continuity stuff, how do you think we could do better with technology and data?
Right. I think collecting data to begin with would be a good start. Unfortunately, what I have my experience working in occupational health is we collect data based on what OSHA is requiring us to do, right? So we're making sure people have hepatitis B immunizations, that people, have, especially for healthcare, that they're protected with their immunizations that they have, and that they've done their fit testing, that they've done their TB testing. But let's move beyond that, and that's what I'm trying to get people to see, that larger vision, especially, again, with hazardous drugs and chemicals. Are we really looking at our populations for occupational asthma, let's say? If they're, in a cleaning profession, or, nurses and physicians sometimes get tasked with cleaning a room, are we seeing increases in asthma? Would we know? Are we tracking that? Do we have the technologies? Do we have the know-how to understand when there might be a symptom, and we could tie it back to a practice? And I think we need to I've done a couple lectures on beyond bloodborne pathogens. Like, come on, let's think of the bigger scope. I think having technologies that are integrated, so if someone's coming in, let's say in a healthcare facility, and they're sampling lab workers for their exposure to formaldehyde, who's keeping track of that? Does that just go to the laboratory manager, and then they know, okay, well, no one's overexposed, we'll put that in a drawer? Is that coming back to the occupational health clinic? Are they having those discussions on, what might happen if they change their practice, and we might want to go and reevaluate? I think it's not really fancy technology, unfortunately. I think it's just bringing those data pieces together. But I've also been thinking a lot lately about intelligent analytics. What can we use with our data that would maybe help predict things? And, in healthcare, again, we're collecting a lot of preventative data, and, can we use that to predict potentially an outbreak that might happen in our hospital? Maybe we've got vulnerable employees.
Sure.
So, it's a concept that I think is maybe getting there in that world, but they kind of have to deal with the day-to-day first and be confident with that before they move to this next place.
Right.
And I was going to say, even with the continuity plans, it can inform such documents, right? So when you sit down and you say, hey, what if this thing happens? Right. You're not just shooting from the hip. You may say, hey, we have this data that says this. Right. Or our workers, commute, or they, for business, we always have to be on a plane 50% of the time. So some of this information can help kind of guide those documents. Let me ask you a question. So Kyle and I, when we talk smart devices or try to implement them on workers, sometimes we get this, well, you're watching me, big brother thing. Is that culture there in the healthcare, with healthcare workers, or is it just...
Yeah,
industry,
that's interesting.
Yeah, absolutely. When I was working as an infection preventionist, the big thing is hand washing, right? So those are our messages: wash your hands. Well, and that's a Joint Commission standard for hospitals to be reaccredited. That the Joint Commissions is the accrediting body, and they like to look at your hand hygiene rates. Well, it's really not worth my time as an infection preventionist to stand there and follow nurses around to see if you've washed your hands. I mean, it's really kind of, okay, these are professionals. They should understand what they should be doing. So there was actually a company that came out. I don't know if they're still in existence, but it would track and see how many times people went to the hand hygiene dispenser. And they had like an algorithm on how many times per day someone should be using that dispenser. going in and out of the room, and you could then track your baseline based on what that predictive algorithm was and the acuity of the patient. That kind of went back to the big brother issue, because people were kind of hesitant and resistant that, hey, you're watching, you don't think I'm responsible enough to wash my hands. So a lot of people didn't believe the data, and you kind of had a hard time like interpreting the data, because they could also wash their hands in the sink. And that wasn't being tracked as much as the hand sanitizer, because there are indications when you use hand sanitizer and when you don't. But, that was one technology that came out to try to track that and monitor that hand hygiene.
That's interesting.
Yeah.
Yeah. And then you also, for that example too, you also get the Hawthorne effect too. So if you're being watched, people will do things because of that influence. And so are they just doing things because they know they're being watched?
Yeah, I'd love to hear the listeners comment on something like that, right? So yeah, if you are worker or not, if you're being observed, your behavior is going to change, which is then going to change the data you collect, right?
Right.
So, but maybe you know that, and so once you hit a precipice, I know this is the Hawthorne effect, so this is how I'm gonna look at these data versus previously. But yeah,
that goes to any PPE, like, right? When you're doing a safety audit, when you're out on the floor doing your safety audit, do you think people wear their hearing protection a little bit more? Probably.
Yeah, it's like, let's break it out of the case now.
Right. Yeah, next to the old emergency plan, we're all busting all those things out. No, that's a really interesting perspective, because I think there's going in, like, a lot of our audience may be more general industry, maybe manufacturing, maybe a sector, but you're talking about healthcare, which is ubiquitous. Everybody's dealt with that. And yet these same principles apply when you think about the health and safety of the nurses that are these frontline people that are dealing with it. That's, I think, very interesting, and I think just speaks to the potential impact of and reach of industrial hygiene as a profession and the benefit it can have to workers and then general society as well.
This is why we need industrial hygienists in all healthcare settings.
Absolutely.
Helping direct, the new devices and the evaluation of that. And, just so many things are in play in these in this world of healthcare, that the skill set of an industrial hygienist just plays so nicely and crosses over to that. We did an article in the Synergist 2 years ago, really outlining, okay, here's what you have to do to meet regulations in healthcare. Here's how an industrial hygienist can help you with that.
Yeah, the Synergist is a magazine by the American Industrial Hygiene Association.
Yeah,
for our listeners.
Yeah, for our listeners. This has been a really interesting discussion, Roberta. And I think you bring a lot of unique perspective to the table. I know I've learned a lot about this. I think we've touched on some really good points in coronavirus in general, COVID-19 specifically, and then some of the principles and practices that you can apply. So I just appreciate you coming on, Mwangi, and I appreciate you coming on so much for this. So any parting words for our listeners?
Just wash your hands, people.
Yes. Wash your hands.
And this virus, I heard a good description this morning. This virus doesn't have legs or wings. So the only way you can get this virus is yourself. And giving it to yourself. If you're touching something and you touch your face, you could potentially be transmitting this virus. So wash your hands.
Now, before we leave, I do want to get into the impact of it, because washing hands is like the same respirator. I washed my hands. What is proper, from your perspective? What is proper hand washing etiquette?
So cleaning, this is if you guys ever need a science experiment for a child, this is a great demonstration.
Mwangi and I are both fathers of young children. So
exactly. So Science Day, this is a great project.
Yeah. Okay.
There's a product called Glow Germ, and I did this with nurses, with surgeons, everyone, and it's like a glow in the dark product, so you can put it on your hands and you can wash and see how well you get it off your hands. So you kind of look under a black light to see if it's there before and after.
Yeah.
I think a lot of people just tend to wash their palms,
Sure.
and that's it. Really getting the tops of the hands in between your fingers up to your wrists. People say the happy birthday song.
Sure.
ABC's yesterday, I heard people using Baby Shark, and you do Baby Shark until Daddy Shark is the song that you can sing.
boy.
So not to put that earworm into your head right
Yep.
now.
Nope. There's a nightmare going on in my head. Thanks for that. 'Cause I thought I had drowned that one out. But no, that's a really good, simple way to go about knowing that it's about all those proper techniques that are there. So everybody, after you're done listening, wash your hands, or even pause this right now and just go wash your hands.
Except if you're driving, don't pause.
Yeah, except if you're driving, no pause. No, but so thank you very much. We appreciate you being on. So this is
great.
episode 3.0, and we are out.
See you later.
You're listening to Probability Matters, brought to you by the Rocky Mountain section of the AIHA.